Tables have turned, now I'm up all night. I'm picturing you, acting like a fool. I'm on the other side, you're like a full moon.
Hi guys, welcome back to my channel. I'm so happy to be here as usual. So we're finally gonna get to do this video. It's been a long time coming. I have taken so much time making this video because I guess when I started my YouTube channel, I was like 21 weeks pregnant. So I had already passed this week, that's week 14, like from week 4 to week 21, if I'm not wrong. So many of you guys have requested that I do the previous weeks and how I was feeling or what is to be expected, or like just fill you guys in. So I'm finally doing that. Yeah, I hope you're having an amazing week. If you're new here, my name is Cynthia and I talk about pregnancy and I talk about everything to do with life, especially for women. I'm gonna involve the men at some point. But that's what I talk about. So please make sure you subscribe to my channel. Always wait. I upload 2 times a week. So yeah, always wait for my videos. Let's have fun and let's learn about our bodies and pregnancy. So without further ado, let's get to it. So I'm gonna start with week 14. I think I'm gonna do 2 weeks each. Yeah. So I'm gonna do like I had done the first trimester, that was week 4 or week 5 up to week 13. If you have not watched that, I'm gonna leave it down. I'm gonna leave a link down below so that you can follow up and catch up, then continue with this one. Yeah. Okay. Oh god, I'm getting so winded talking these days. Yes, so bear with me. Week 14. So finally, at week 14, you're in the second trimester. Yay! Let me tell you, it's so amazing to be in the second trimester. Okay. You feel so good. You feel so energized. You feel, like a superwoman. You feel like your old self again. And okay, well, not completely, but like you get my drift. You just feel really good. Yeah, I can promise like maybe 80% of the women watching this, you're gonna feel good. Some of us don't get the relief when you hit second trimester, but you know what? Hold on, keep pushing. It's not gonna be forever. It's only 40 weeks or 40 to 42 weeks, depending on when you do. Yeah, and you're gonna be done. So just keep going. Okay, the first thing at week 14 is that let's start with baby. Baby is 3.5 inches long. Yeah, the other thing is that baby's immune system is developing. So I read somewhere that the reason second trimester becomes a bit more manageable is because now baby is really growing and he or she is getting used to depending like on their own body. You see, like now they're saying the baby's immune system is developing, so they really don't depend on you so much. Like with, I'm gonna research more about this. I think like with the blood pumping in their bodies, so you're not so exhausted, because like now it's just the initial stages of development have more or less finished. So now it's just the advanced stage. Yeah. So the other thing is that during this week, the baby also starts moving around. You might not feel them, or you might. I remember that I used to feel like a twitch. You know how you can get like a twitch in your eye or like on your eyelid? I used to feel that, like like just a very small, like if you are not keen, you would actually not feel it at all. Yeah, so you might feel that. According to this, during the 14th week, nothing much is really happening to baby. Just those 3 things: 3.5 inches long, immune system is developing, and moving. The flutters, or sometimes nothing. But that doesn't mean that your baby is not moving. It just means that maybe you can't feel them. Yes. Let's move to mama. Mama at this point might experience some headaches and dizziness. I had a lot of headache during this time. I remember it was kind of bad because like when you have a headache, you really can't operate normal because like it's your head, but and you can't take any medication. So I used to sleep it off most of the time, or I would drink water, really cold water. I never got any dizziness. The other thing is that you might start feeling abdominal pain. And by abdominal pain, this is like, you know, where your what do you call it? Like, you know, that joint where your leg connects to your midsection. You know, I don't know how to explain it. So like they say that your body starts producing relaxin. It's a hormone. So your muscles are, you know, loose. And so if you start feeling this abdominal pains, most of the times it's called the round ligament pain. And that's the hormone that causes it, because your muscles are, you know, getting ready. Yeah, so actually I had someone ask me this question on Facebook. One of my mentoring a few people, and a lady actually asked me because she's feeling this pretty early, and I also started feeling it very early in my pregnancy. So if you feel this, just try to, you know, move a bit slower. Don't, you know, when you're not pregnant, you just shoot out of wherever you are, you know, like you're not really bothered, but now you have to be much more careful. You have to make sure that you're resting. You have to make sure that, you know, you're just really careful. Even how you sit, you can prop yourself with some pillows like on the side, so that, you know, it's not too bad, because it can really actually get bad to a point where you can't walk. So to avoid getting there, just try to, you know, meet those needs before they arrive. So just move slower, rest very well, prop yourself up with pillows on the side or on your back. You see, even now as I'm talking, I'm propped up pretty well, like on my back. Yeah, so my back is like straight. Yeah, try not to crouch so much, or to you know, like sit in weird positions. Yeah, so apart from that, there is less fatigue, as I said earlier on in the video. The peeing will reducing. The peeing that we talked about in the first trimester is really gonna come down, and I have experienced this, and it was heaven sent. Let me tell you, it's so amazing when you really just don't have to keep going like to the washroom. And then, you know, during this time you're told to also drink a lot of water. In that case, on that note, let me drink some. Yeah, you're told not to drink lots of water, so the peeing is gonna come down. Don't worry, you won't be peeing all the time. It's still gonna be high, but not too high. Your bust is gonna get bigger. This is standard, I think. If yours does not get bigger, then you're part of the lucky group, because they get big and they get heavy, so heavy. So yeah, those are the main symptoms and positives of that week. My week was pretty easy. I really didn't have, apart from the headache, I had a really good 14 week. Yeah, so I think we can move on to week 15. If you have any questions concerning week 14, if you feel like it's something I have not talked about, please feel free to ask me. Leave a comment down below, DM me, you know the drill. Yeah, so let's move on to week 15. So week 15, there's a couple of things going on. As usual, I have my notes. Week 15, let's start with baby. Baby is about 4 inches long. So as you can see, it's like they grow half an inch every week. So we've gone from 3.5 to 4. And at this point, they are the size of an avocado. I love avocados. Yeah, so at this point, they say that the baby starts looking more human. For example, you know, like when they're pretty small, the eyes are not in the center of their face, like it's like they're on the side. So now during this week, they are starting to move to the front. So, you know, like they're starting to look more human than it's a tadpole. Yeah, I think so. Yeah, so the other thing is that their heart is pumping lots of blood. They're also inhaling amniotic fluid. This is gonna help with the air sac development, so that they can be able to breathe when they join us on the earth side. They're also able to bend their knees and their elbows. So you see, as in, they look pretty human at this point. You know, like that's just really amazing. So moving on to mom. Mom is gonna start feeling a bit big. At week 15, I know I was actually feeling, yeah, I could feel that I was growing, especially around my bust area, because I didn't start showing till like week 20. So, but I could feel like, you know, you're heavier, you're slower, yeah. Then what else? Since you're circulating more blood, you'll start experiencing a stuffy nose. So you should avoid smoke or dust. I remember I really struggled with this. I would always wake up with a stuffy nose. At some point during the day, I would have a stuffy nose, and it's really annoying. I remember I used to use a lot of oil baths. It really helped me a lot. Yeah, so if you're feeling that way, you at 15 weeks, you can purchase that. It's pretty safe when you're pregnant. Yeah, and it's gonna give you some relief, especially at night when you can't sleep and you're feeling stuffy, and you know, and it's just it's so uncomfortable. So you can get that. It's gonna come through for you. Yeah, so just avoid smoke and dust, and sometimes you're just gonna be prone to the seasonal allergies. So there's really nothing much you can do about that, but you can use the oil bath to assist you, or use a humidifier in your room, or just wherever you are. It's really gonna help, you know, with just making sure that the air is a bit humid, you know, so it's not so dry and it's not affecting you and making you feel congested. Yeah, the plus side to week 15 is that some women start experiencing the pregnancy glow. I don't think I experienced a pregnancy glow during this time. I actually had a bit of acne, and it's not like acne, it's just a rash. I had a rash going on, but I also feel like it's because I wasn't really taking care of my skin. I had really just, I was so tired. I was so over the first trimester. So now is when I've started. So yeah, I had a bit of a rash, stroke acne, but I'm not so sure where exactly it was coming from. Then I realized, okay, I'm done with week 15, by the way. If you have any questions, if you have anything that you feel like I've forgotten, please comment down below. I forgot to mention something. When I think in your first trimester, you might get some weird, symptom. For example, I had a really bad cold, like a coughing. It came with a cough, a running nose. I would be out of breath, like to a point where I would feel like I'm wheezing. I even went to hospital and they tested and they're like, there's nothing wrong with you and there's nothing we can do. We can't give you any medicine because you're pregnant, and you know, during this time, everything you take goes straight to the baby. And I was so frustrated. The reason I'm talking about this is because someone asked me about if I got a flu. And yes, I did get a flu. I got a really, really bad flu. I think the whole of my first trimester I was sick. And the thing that ended up helping me is a flu mixture. Oh, I don't know what to call it. It's you make it using pineapple juice, fresh pineapple juice, cayenne pepper, ginger, lemon juice. What else am I forgetting? Yeah, and just like some water. So you just boil all that together and you take that. So I would make like a tall glass and have just sip it through the day. It has a really weird taste, but it really came through for me. It helped me, like, you know how some women say that they have a cold throughout. Whenever even I feel a sore throat coming, that's what I drink, and it's a miracle worker. So try that hack. Let me know if it works for you. Yeah, don't let that flu take all your happiness. It's because I know how it feels. It's a really bad feeling. Yeah, so I think that's it for week 14 and 15. I'm gonna do week 16 and 17 in another video. I'm not sure if I'm gonna shoot it today, but we'll see. Because week 16 is a bit I'd call it lengthy. So yeah, I hope you enjoyed this video. As usual, please follow me on Instagram, follow me on Facebook if you need a mentor. Slide into my DM. I'm always ready to talk. Yeah, I think that's it. So thank you for watching. Remember to like, share and subscribe. And yeah, let's meet on the next video. Bye bye.